Hello everyone, I am Dr. Prateek. I am going to describe treatment of OCD with microfracture. Our patient is a 21-year-old man who is suffering from left knee joint pain with swelling since last 1 year. This is the MRI showing classical involvement of the medial femoral condyle. OCD is described as a pathological lesion affecting articular cartilage and subchondral bone of various joints with variable clinical patterns. OCD can be classified into either a juvenile form or an adult form. The most common joint involved is the knee joint. The most common part of the knee joint that is involved is the posterolateral aspect of the medial femoral condyle. The pathogenesis of OCD is thought to be either hereditary or traumatic or vascular in origin. The most common cause of the adult form is thought to be of vascular origin. Clanton classified OCD into 4 types. In our case, part of the OCD fragment is fractured and displaced, whereas the other part of the fragment is fractured but not displaced. So in this case, our plan is to excise the OCD fragment and heal the defect with the growth of fibrocartilage by doing microfracture procedure. So we have excised the unstable OCD fragment. As you can see, the dimension of the lesion is 10 mm by 20 mm. After having prepared the bed of the defect, we introduce angled awl to create microfractures. The technique of microfracture is indicated when the cartilage lesions are less than 2 to 3 square centimeter size. It involves creating holes of 0.5 to 1 mm diameter through articular cartilage into the bone marrow cavity. Following are the factors which are responsible for the success of the microfracture procedure. While preparing the bed of the defect, the calcified cartilage layer must be removed, but the abrasion of the subchondral bone must be avoided. A 1 to 2 mm bridge of bone must be left between the penetrations to allow connective tissue to fill the defect and adhere to the base of the defect. The joint function must be maintained after the surgery by the use of early continuous passive mobilization. Protected weight bearing must be strictly enforced depending on the location of the lesion. And the last factor is to correct any significant abnormality in the mechanical axis with the microfracture procedure. So now we have deflated the tourniquet to visualize the oozing of the bone marrow material through the microfracture holes. This is the unstable OCD fragment which was excised from the joint. Thank you.